biggest tragedy that we see is a preventable loss of life. It's when people pay the ultimate price, and as healthcare workers, the tragedy is that that loss of life could have been prevented with vaccination. Now, it's absolutely true that with vaccination, a very, very small minority of people may get critically ill and may even die, even with vaccination, with some of these new variants like the Delta variant that we're seeing. But that proportion is so small, and the overwhelming majority of people could be saved. They could be at a point where their lives aren't devastated, where the lives of their families aren't shattered, and it could have all been prevented with the effective vaccines. And I think that is the greatest tragedy for us as healthcare workers, because we get to see the suffering, we get to see the broken lives, and we see them dying in what could have been a preventable tragedy. End of July 2021, we have a very, very effective way to prevent getting sick with this virus in the first place. But despite that, there is so much misinformation out there in the community. There are so many people that are not making the right decisions because of the misinformation out there. And again, I don't blame them. I feel sorry for them. I feel sorry for our society that we don't just stick to medical information and try and save people's lives, because ultimately that's what we are here for. That's what we want to do. And I think that the situation is so much more tragic now than it was a year ago, because now we have a way to prevent this.